All right, we're gonna go ahead and get started tonight. Hello, everyone. My name is Chapin, and I'm a medical student at the University of Washington. Welcome to Doctors for America's Med Student Advocacy Series. We are so excited to bring together these three panelists to share their experience and knowledge with us on this subject with the election just around the corner. This is the first session of a three-part series on advocacy involvement. Tonight, we will be discussing electoral advocacy. The next session is on November 12th, and it will cover federal advocacy. The final session is on January 14th, and it will cover state-level advocacy. We will be sharing links with more information at the end of the session. Before we get started, I'd like to take a quick minute to invite you to officially join Doctors for America if you are in an MD program. DFA team member will put the link to join in the chat if you would like to learn more. We will be live streaming on Facebook tonight and also making a recording, and all materials will be available after the session. A few quick ground rules. 1, there is no such thing as a stupid question. All questions are welcome. Number 2, speaking of questions, please remember to use the Q&A feature. We will address your questions during the second half of our session, and also look out for comments in the chat as DFA staff will be sharing helpful links during the session. Now, without further ado, on to tonight's panel discussion. We are thrilled to welcome three incredible speakers. First, we have Dr. Anita Penuelis, a family medicine physician currently working part-time as a physician for Seattle Medical Associates. She grew up in Seattle on unceded Duwamish land, so she has deep ties to the Pacific Northwest. After a formative 2 years living and working on the Dene Reservation, she returned to the University of Washington to obtain a master's in public health in maternal and child health. She worked for several years in public health programs before completing medical school and family medicine residency at the University of Washington. Woohoo! Most of her medical career has involved direct patient care, but she has always remained interested and engaged in broader public health issues. More recently, as the climate crisis has become the biggest public health issue of our time, she joined the Washington Physicians for Social Responsibility Climate and Health Task Force and the executive committee of the board of directors in order to help influence the deep policy changes that are needed. This election cycle, she's devoting almost every waking moment to the Center for U.S. Voters Abroad, a nonpartisan nonprofit which helps overseas voters get registered to vote. Next, we have Aaliyah Bhatia, who serves as the executive director of Vote ER, a 501c3 nonprofit organization working to integrate civic engagement into healthcare. Founded by Dr. Alistair Martin, Vote ER works across all 50 states in rural and urban communities and in settings ranging from mobile clinics to major academic hospitals. Since 2020, Vote ER has helped tens of thousands of healthcare professionals and patients get ready to vote and has appeared in the New York Times, The Guardian, the Stanford Social Innovation Review, the Washington Post, NBC, CNN, NPR, and more. More than anything, Aaliyah relishes working at the crossroads between different fields and disciplines. She loves projects and conversations that cut across topics such as democracy, diversity, leadership, education, housing, health, technology, policy, and international politics. Outside of work, Aaliyah enjoys spending time with her friends, mentors, and former students. She dabbles in the arts and can occasionally be found practicing improv or painting. Dr. Sappho is a Ghanaian-American board-certified HIV primary care physician, public health advocate, and the founder of Just Equity for Health, a healthcare improvement company that uses advocacy, education, and care model design to ensure equitable care delivery across all sectors of medicine. Dr. Sappho has experience in clinical transformation and healthcare redesign in academic and corporate healthcare settings, as Senior Medical Director and Chief Clinical Transformation Officer, respectively. In addition to her commitment to population health and care model design, Dr. Sappho is dedicated to equity within healthcare. She is a founding member of several organizations dedicated to gender and racial equity and to civic engagement in medicine. Dr. Sappho completed her undergraduate, medical, and public health degrees at Harvard College, Harvard Medical School, and Harvard School of Public Health. She resides in Brooklyn, New York, and enjoys traveling and reading. So I think we are just going to dive in. So excited to have these panelists here. Our first question is to whomever would like to go first. Please tell us about your background and your journey into advocacy work. How did you choose the specific advocacy work that you do?
I'm happy to start. So I went to residency in Montefiore in our social medicine program. And I specifically chose that program because I was really interested in the intersection of kind of how the social drivers of health impacted patients' care. And so we were working with providers and in a health system that really got it, I think, and understood even before kind of an SDOH focus became kind of more of the norm in healthcare. And what I found in that program and what I think really radicalized me was just kind of understanding just how broken the systems were because patients were coming in and we were giving them the best treatments and they were still coming back because so much of what needed to be addressed were outside of the clinic walls. And more than that, I think the thing that really impacted me was seeing my mentors who I admired so much just over time get burned out and either quiet quit or quit kind of altogether. And I thought to myself, if these leaders who are individuals who are so committed to social medicine are feeling fatigued and tired over time, like I don't see our careers in this lasting for a long time. And I was doing primary care. And primary care I think really is in some ways the foundation of our healthcare backbone. And so it made me really interested in this question of how do we improve healthcare for those who are delivering it and the patients who we're trying to take care of. And with that, I went to Mount Sinai and then I went to Premier, a healthcare improvement company. And both of those places were interesting because big health systems and then big healthcare companies hold a lot of power. And it was really interesting and again, radicalizing to me to see how they use that power. After some time in those spaces, I became really interested in more grassroots organizing. And so I co-founded Civic Health Alliance and I founded my company, Just Equity for Health. And in that role, I've been doing a lot of work, really partnered with those who are kind of most proximate to the issues that I'm interested in investing in around gender and racial equity, around civic engagement. And I just think what's so powerful and what kind of keeps me in this work, and specifically in advocacy work, is that the tides are changing because people are really demanding that that change happens. I remember in 2020, we were, gearing up for another very consequential presidential election. It was my patients who were coming in who were asking for help with voting, with registering, that kind of pushed us at that time to form Vote Help 2020, which then became the Civic Health Alliance. And so I feel as though if we in leadership positions within these health systems, within these healthcare improvement companies aren't getting it right, it's just a matter of time before those who I think are on the ground, who are experiencing the negative side effects of the kind of structural inequities that are baked into these systems, to really start to demand better. And I'm seeing that more and more. And that's been very, very galvanizing. And it's been a true pleasure to get to walk alongside those individuals that are demanding change and helping us imagine, I think, a better and a brighter future in healthcare that actually serves all of those who need serving and particularly looks out for populations that have been historically marginalized.
A longtime advisor of ODR, Civic Health Alliance is a longtime partner of ODR, and there are parts of that story that I didn't know, and so I'm glad that we got to start with this question because it's good to have that kind of journey component to knowing where everybody comes into the puzzle from. So I think I'm the person on the call who's not a healthcare professional or provider, and so my journey looks a little bit different. After I finished undergrad, I taught in New Orleans a few years after Hurricane Katrina, and I taught 11th graders, just the best 11th graders on earth. I will compete with anybody for how cool my 11th graders were. And just had a really, really incredible opportunity to teach and learn and grow alongside them as well. And one of the things that happened was I was teaching when Trayvon Martin was murdered by George Zimmerman. And I came into school the next day, and my 11th graders, who wear their purple hoodies to and from school every day, often walk home from school, go get, their Arizona iced tea and their Skittles at the corner store. They come into school and they're like, so the guy who just killed Trayvon Martin, who looks like us, he's not behind bars. Many of these students had uncles, aunts, family members who for much less than murder had been locked up and put behind bars. And having to try and explain to them some rational or logical reason why the person who had just killed Trayvon Martin was not being treated in the same way as any of their family members would be treated. It was absurd. There was no logical answer. And it was in that moment that I realized that while teaching 11th grade math was incredibly fulfilling for me, it was not the way I was going to drive systemic change. When I moved home to Atlanta and went to a protest right after George Zimmerman was acquitted, there was a woman waving a clipboard asking if people were registered to vote. And I had just moved back from Louisiana. I had not re-registered in Georgia. And in filling out that form, I felt a sense of having agency and hope and being able to change a situation that I knew was really dangerous to my students and to their futures. And I think that that was a big part of my path towards this work. I did some work on school board elections, both in Louisiana and in Georgia, kind of as my like starting point in advocacy. Went to policy school, and then when I moved home from policy school at Harvard Kennedy School back to Atlanta, I went through 5 health insurance cards in 5 months, rather unexpectedly. I went through just one of those weird career situations, and sure enough, grad school does not offer COBRA, so you have to figure it out if the job that you move home for doesn't work out. And I actually was just cleaning out. I mentioned to a few folks on the call, I'm about to move back to Atlanta in January, and I was cleaning out to figure out what do I need to take home with me. And I have this folder where I have kept all those different health insurance cards. I had no idea when I was insured by which one, what my cost of my prescriptions was going to be. I would get like prescriptions that I thought were a certain amount and then get a letter in the mail later saying, actually, you owe X amount. And I'm like, but I paid this amount at the counter for it. And it was not long after that that I heard about VoteER and the opportunity to help our patients and our communities have a voice in shaping policy. And as somebody who by that point had been pretty directly impacted by health policy and the failures of it, to provide adequate, and thoughtful and transparent insurance to communities. And again, as somebody who had a policy degree and still couldn't figure it out, I really wanted to get on board with the opportunity to make a difference. And that was how I came to the work at VoteER, and then to be able to partner with groups like Doctors for America and the Civic Health Alliance. And it's a treat to spend time with you from that perspective of not necessarily being a health professional, but having directly experienced some of the underbelly of some of those health policies that we're all constantly navigating in our work. So it's a bit about my journey.
So that leaves me. And I came to advocacy late in my career after 20 years of being a family physician. I was brought into it by my 2 children in college who became activists uh, uh, in bicycle brigades during the George Floyd demonstrations, along with Chapin, or trying to shut down campus to advocate for a fossil-free investment policy. To you name it, they did everything. And I started to see how powerful their voices were and what change, amazing change they affected along the way. And finally, one of my children called me and said, "Mom, there's a doctor on TV. He's a family doctor in Seattle. He's part of Washington Physicians for Social Responsibility. He's in a commercial advocating for a very important initiative at the time. I think this was 2017, 18, to implement a carbon fee on the biggest polluters in our state. Why don't you do this?" So I called up, and the next week I was on a commercial. They needed a female physician with children, and they were putting makeup on me, and I was scared to death. And it just started this whole life of becoming a legislative advocate, from the voice of a healthcare professional to our legislature, and advocating with climate scientists alongside me, and nurses and pharmacists and all kinds of health professionals and community activists to change the laws in our state and strengthen our ability to take care of our community. Ruth Ginsburg said something like, the greatest way to take, to lead a meaningful life, I'm paraphrasing, is to take care of your community. And it's really true. It's really been empowering. And instead of feeling helpless and hopeless, I have felt like the things I do matter and they're effectual. Along with my children's journey about activism, they started realizing that actually getting people elected who can make change and helping write policy, and then getting people registered was important. And my one of my children started a nonprofit which helps voters abroad get registered. And I started working with them, and we have registered 164,000 people overseas. That there might be some overlap with folks who have registered in the past, but this is a new demographic. Lots and lots and lots of people saying, I haven't voted in 25, 30 years. Please help me. My husband said he'd vote. How do I get him registered? So much energy. The day that Vice President Harris became the presumptive or the nominee, we got 8,000 in our inbox. And so being part of this movement to try to get people, help people vote and have them have a voice is just so exhilarating. And I am grateful to my children for pulling me along, because I wish I'd been doing it all along.
Wow, thank you all so much for sharing. It's just so inspiring to hear all of your journeys to where you are now. So our second question is, what role do you think healthcare professionals play in advocacy?
Well, I can speak to that first. As a family doctor, I never wore a white coat. You walk into a room with a 3-year-old in a white coat and they're going to flip out. So I never wore one. I never talked about being a doctor in my personal life. I played tennis with the same group for 5 years before they knew I was a physician. It was just who I was in the background. But I have found that in an advocacy role, and this isn't physicians, actually nurses have a higher level of trust than physicians do in the community. We've done research on this. All health professionals, pharmacists, dentists, mental health professionals, you name it, we bring with us a certain amount of education, expertise, a knowledge base about the health of the community, where it impacts people's lives, and we're listened to. So I feel like as health professionals, we have a voice and people listen to us. Legislators will literally open their door when I reach out to them to talk to me, because they think I know something. I mean, the only reason I know something is that I work for with an organization who hands me notes. I don't know the particulate composition of natural gases, but I have it in my hand and I can speak to it. I don't know the economics of a gas tax versus a gas or a fossil the gas tax versus a gas fee, but I can get the information and I can convey it. I can testify in my white coat, which I had to drag out of, from 20 years ago and wear, and people listen. So I think that we have a voice. We have trust in the community. We have something to say. We know stuff. So I think it's really impactful and really helpful.
I'm happy to jump in. I would say it's so interesting because it does feel like there's been a little bit of an erosion of trust in the health professionals since 2020. And I was doing some research recently for a talk, and despite that, we're still considered health professionals are still considered some of the most trustworthy professionals for Americans. And so for those who are like, people aren't going to trust me, they don't believe me, there's the public trust in their healthcare professionals is still maintained despite, I think, the erosion of trust in institutions and public health since COVID. So that's the first thing that I would say that I think, Anita really spoke to in a way that is just intuitive to many of us. And I love really bringing in that it isn't just physicians, it's the whole healthcare team. But, part of the reason why I think, why healthcare is, if you think about the kind of logistics around it, I do see HIV, I do HIV medicine. And so I have a very, very busy panel. And unfortunately, my patients are often waiting for me, right? And so when they're sitting in the waiting room, that's kind of this, like wasted time where folks are on social media or they're just kind of, reading or whatever. But it's time that we could be really, really engaging individuals. And so there's the opportunity as well within healthcare settings. And, we know that legislation supports nonpartisan get out the vote efforts in healthcare settings to be legal. That's one of the first things people ask. Is that allowed? Yes, it's allowed. It's encouraged. And so I think in addition to trusting healthcare professionals, there's also just the opportunity of healthcare as a space for that. In 2020, or 2022, there was a study done among individuals who hadn't voted in the 2020 elections, and they asked some of them, would you vote if it was more convenient? Many of them said yes. About 30% said no, I don't want to vote. But many of them said yes. And they said, well, where would you want to vote that would make you kind of be more likely to vote? And 20% and 20% said they wanted to vote in their pharmacies and they wanted to vote in their healthcare facilities. And so I just want to kind of call up for us, in addition to this trust factor, which I think really is intuitive and comes to many of us, the convenience factor and the opportunity factor. You know, people are busy. There's a lot going on. People have 2, 3 jobs. People are juggling a lot, right? If in healthcare we can make it more convenient for folks as well, I think it's a real charge, because we always tell people, or many of us tell people, I know all of us on this call believe this, that, vote for your health, right? You're voting for policies in, legislation around gun rights, abortion rights, reproductive health, climate change, all these things that directly impact your health. What if we went one step further and we said, let's help you to actually manifest your ability to vote by really bringing it to you within our health facilities? And so I just think it's like, being a little bit more provocative and pushing ourselves to think, yes, trust is there, but also we can be a place of convenience to help folks actually do this and do this well.
Yeah, I'll second everything that Anita and Stella shared, and I think they've made the powerful case for why health professionals can be involved in advocacy, supporting our patients, supporting our communities around that. I'm going to layer in one story quickly from 2020 at VOTER. VOTER was basically founded in 2019 by an ER doctor, Dr. Alistair Martin, who, for a variety of reasons, figured out that his patients weren't frequently being asked about voter registration, and they were some of the folks whose voices were most missing from the conversation. Well, the first version of ODR was a iPad kiosk, and you had to it sat in the waiting room, and while people were waiting for their appointments, they could go in, register to vote. This becomes a problem at the beginning of COVID when you were nervous that a iPad kiosk could be used to spread a disease, right? This is before we knew much about how COVID got spread. Also, there was the number of people coming to ERs was also plummeting. And so I very distinctly remember Alistair and I getting on a call. It was the end of, it was 2 weeks after COVID had been declared a pandemic. We got on a call and we're like, well, we know 2 things are true. The first is that how we've been doing this with this iPad kiosk business, that is not going to work for the rest of 2020. This work is more important than ever before, but we can't do it that way. And the second thing we know is we have absolutely no idea what we are doing, and we're going to have to get some help. And so who do we call? 2 of our first calls were 4th-year medical students, because COVID had basically upended their entire curriculum. And a lot of folks were trying to figure out, how can I make a difference? And I would say that much of the foundation of VOTER today was a set of health professional students, a couple social work students, and a couple medical students who really redesigned how VOTER operates and what we offer and different pieces like that. So, part of what I would say is there's certainly the portion of the work that is facing our constituents, facing our stakeholders, but there's also this internal capacity building piece that if that is your strength or superpower, that's okay too. And that's another place that's valuable for you to plug in. And we all find different channels, and it takes all that different diversity of different ways of showing up and leading and being that brings us together to build strong advocacy efforts. So layering that into the conversation as well.
Great. Next question, thinking about, all of this work that you're doing in healthcare settings, what does sustainable advocacy mean or look like to you?
Short answer. So I'm going to start, but then I really want to hear from Anita and Stella, who are actually, health professionals. I'm not that, so I can't speak as that. What we noticed, those same 2 health professionals, students, those 2 medical students who helped kick us off, they were both 4th-year medical students. So what was their next year? Internship year. How much time did they have to be part of ODR? This much. And so what we have designed at VOTER is a recognition of this idea of a pit stop. And so one thing we do to try to support the sustainability of our movement is recognize when people are in that pit stop zone, because it's first year of internship, for example, it's another super intense year in their journey. And so then we intentionally sort of keep them part of the community, but don't have as much expectation, so that they can step away for the time they need to get regrounded in their new city, new place, new work, and the like. So that's my contribution to a question that I don't feel qualified to answer, but that I know that we've been putting some thought into from more organizational design perspective. So that's mine.
I'm happy to jump in here. I think what I would encourage medical professionals as they're in their training journey is to ally themselves with an organization that's ongoing, where they can dip in and dip out. To speak for Washington Physician for Social Responsibility, there's all kinds of opportunities to go to a training to learn how to write letters to the editor, to learn about the legislature and how it works, to show up for one rally, to learn remotely about legislation that needs a bump. You know, just sign this letter to your legislator, bring it to their attention. So there's all kinds of levels to jump in. The organization, whatever it is, a voting organization, a climate organization, a health and equity organization, an organization that's already working all the time and that you can dip in and dip out. I would say that the medical students and residents that work with us, albeit their work is intermittent because they disappear when they're on surgical rotations and all that stuff, they're incredible because they drop in, they help, then they move on, and they know we're there, and we're so happy to have them, and they are the future leaders of all these movements. So that would be, and then the other thing is to, I just coincidentally today found an article by Nadia Boltz-Weber, and I'll put it in the chat about buckets. You have a bucket of water, but if you pour out all your water, you don't have any water left to deal with the smaller fires. And so you have to marshal your water and get it filled up again. And it's just a lovely article about how to be personally keep yourself sustainable over time in your activism, not wear out your water bucket, but make sure that you can attach yourself or help or move in or jump in when you can, um, for the long term, not just for the short term. So that's my answer. I'll turn it over to Stella.
I love both of those answers. I really like, Aaliyah, your framing of the pit stops, because I think it's important in healthcare to give ourselves that space. I think in general, part of the work that I feel called to do with Civic Health Alliance and with some of my other equity efforts is to really think about like how we change the culture in medicine, because it does feel a little bit like there is an all or nothing attitude, and a lot of people don't really consider, I think a lot of people don't really understand kind of what falls under the bucket of advocacy, right? It's advocacy to help your patients achieve good health. It's advocacy to write letters of compassion for patients who may be jailed. It's advocacy to march. It's advocacy to do town halls. It's, all of it does fall under this umbrella. And so I think sometimes what we do, and what especially young folks do and trainees do, is they have this expectation of like, if I'm not, signing up 1,000 people to vote, then I'm not kind of doing it. And I just think it's important, especially for what Anita is saying, to really think about what is sustainable and what you can do in the moments that you're in, and then do that. Specifically as it relates to civic engagement, I feel very strongly about kind of making sure that people start where they're comfortable, because you will hear these stories. And I think, if you spend time with Aaliyah, like she's a very, very good storyteller, and she has incredible people that work with her and alongside her. And you hear these stories and you're like, I want to start this thing, or I want to go and like advocate in a way where I'm like sitting next to VP Harris, right? And all of that is amazing and wonderful. And yes, you should, but also you should start where you can. And for some people, that means, reading an article about civic engagement and health. That means helping one patient get registered, right? And so I think that the reason why that's so important for sustainability is that it helps you to build a sense of, I can do this. And then you get more emboldened. And so I loved when Anita was like, I called and they put me on a commercial, and some folks can't do that, right? But if you can, like, those opportunities will come. You'll be asked to testify. You'll be asked to lead a group. You'll be asked to. And so I think starting where your comfort lets you start allows you to build the skills, the community, and the know-how to keep kind of going from there. And then, the last thing that I'll say about this is that it's really important to focus on the why. For many of us, the why relates back to our patients. I every patient that I feel like has suffered or died from something related to a structural design of healthcare, or a health policy, like I remember it so vividly. It doesn't leave you. I think about those patients moment to moment when I'm thinking about why, even though I don't want to like do this thing that I need to do, that I'm going to do it. And so going back to that why, I think continues to build that sense of just drive that you need, because I think it's important for us to acknowledge like everyone's lives is so busy. We are doing so much. And then on top of this, we're asking ourselves to be advocates and activists and to show up and movement build. And that's a lot and it's hard. But tapped into your why and starting where you're comfortable and confident, I think really allows us to survive in this long term. So does all of us doing a little something, right? If all of us carry a little bit of this weight, none of us have to carry the whole burden. And so I think that that's really something that I try to remind all of us of, because it moves us forward as a collective, which is what we want.
Well, thank you all for your wisdom, like really some excellent thoughts. So a lot of us, or most of us, should be professionals in training. So it would be really wonderful if each of you could share, what do you wish you knew about advocacy earlier in your career?
Yeah, I can start with that. I think the thing that I thought of when I saw this question is that I wish that I knew the ways in which advocacy showed up. I don't think I had quite the sense, having trained in classic academic settings, of what advocacy looked like. And as I've gone forward, that has expanded. And so, for example, if you're someone who's a clinician investigator who's very invested in research, advocacy could look like you testifying based on your research, in your state house or in Congress around something that could really change the lives of hundreds of thousands of people. If you're a medical student, there's so much power that you all carry because you are paying to be there, and the institution cares greatly. What advocacy looks like there is about moving as a collective, so no one individual is singled out and kind of targeted, and therefore may lose their career. And so I think the thing that I wish that I had a better understanding of is the forms of advocacy that advocacy could take, and the ways that my career could be designed to allow me to dip into those forms that I'd be most comfortable with. And I try, now that I have a better understanding of that, to really impart that sense to individuals of, you can start wherever you are and you can do something that will be helpful.
I would support that. I thought advocacy when I was a medical student was standing in front of people and testifying or being a big voice, but I've learned since that it can take small steps. And I had an example by a nephrologist colleague of mine who's on this webinar. At her local hospital, the doctors all had a really safe place to park, but the nurses had to go in front of traffic and in the dark, and there wasn't well lit, and one of the nurses got hit. And despite multiple requests to the administration of the hospital, nothing happened. And then she organized a walkout with other professionals in her hospital and nurses, and didn't take very long. The hospital didn't want to be on the front page of any paper. I think maybe it was. They fixed it. The city stepped in, the hospital stepped in, they got a crosswalk with lights. The story might not be completely right, but it got fixed. So that was a small thing. But the medical student at UW who started asking questions about GFR for African American patients, and was that racially based and was that valid? That was a medical student. And it just sparked this question sparked a change in policy and the way we look at that. So it can be little, it can be big, it can be in your community, it can be one-on-one. I asked the 10 medical assistants in my office the other day who was voting, and only 2 were voting. So we had a spirited conversation about, many of them are single parents, and it just nonpartisan. I'm not their boss, I'm just another, but I think a few of them went home and thought about voting. I mean, it's just small stuff, but thank you, Stella, for saying that. Both the ways and the amount and what that looks like. And I wish I'd known that more earlier on. Oh.
Agree with both of those. Gonna add in something from a completely different direction that I was thinking about when I read this question written down. One of our advisors is sort of an expert in how movements work. And some of her research looks at the pro-life movement and how it became what it is. Very interestingly, there are a lot of people in the pro-life movement who actually came into it undecided or pro-choice, but they were actually looking for friends in their neighborhood, and the most organized structure of spending time together with people was the pro-life. There's an expression in organizing that you come for the cause and stay for the people. This was an instance where people actually came for the people and then became converted to the cause. The reason I share that is the thing that I wish that I'd known earlier in advocacy, especially as somebody who's worked in the education field, is we have to be really thoughtful about what policy and the downstream effects of the policies that we're proposing. Because once you create enough people interested in the idea that you've kind of generated or come up with, then it takes on a life of its own that sometimes may be bound together as much by relationships as by the sort of factual, veracity of how that particular policy plays out. And so the thing that I think, like, knowing some of my journey through education policy, there's a lot of ways in which my perspectives on education policy changed over time. And I think that sometimes I was part of groups of people that saw things a certain way, and that prevented me from seeing things in a broader way. So I share that as one additional thing that I wish that I'd known sooner in my own advocacy was, once there's a movement of people involved in it, it becomes its own thing. So you have to be really, really careful that the thing that you're pointing that movement at is something you actually want to happen, because otherwise we can have some really unintended consequences and downstream results. Case in point,
That is so interesting. I never knew that about the pro-life movement. That's really, really interesting. Thank you for sharing that.
Wonderful. Thank you all so much for your thoughts. We are now 20 minutes until the end of our session, so we are opening up the Q&A. So as questions arise, please feel free to put them in the chat so that we can ask our panelists your questions, things you're dying to know about electoral advocacy or particular things that any of them have mentioned. And I think we are still waiting for folks to put questions in the chat. One that we have, a question I would like to know is, how do each of you talk to people about the concept of civic health?
I'm happy to kick us off. It's a fun play on words in the sense that it is both about the capacity of a community to drive their own solutions to challenges that they're facing, and it's fundamentally about agency more broadly. But it's got this lovely double entendre to it that lets us talk about healthcare from a standpoint of not just your physical health, but your civic health. So a lot of our health professionals, when they're getting to their question about voting, they'll say, in addition to caring about your physical health, I also care about your civic health. Just want to check, are you registered to vote at your current address and ready to vote in the upcoming election? And so they kind of weave that as their way to redirect the conversation. So that's the thing that we've seen is people leverage it as a way to name the type of category of question that they're about to lean into with their patients, and treat it as the category of conversation. And then I'll add that Civic Health Month in August, I think, gives us an opportunity to shine that spotlight on some of the social determinants that Stella was mentioning that she saw early in her career as impacting the health outcomes of patients, and gives us a time to talk about what it looks like to go upstream and ways that we can go upstream as a health profession. So I think those are the different categories of how I think about civic health and leveraging it.
Well, having never heard that term before, never heard the term civic health. I'm going to come at it a little backwards. Patients come in to me with worsening heart failure or worsening COPD caused by wildfires in our area or by extreme heat. And we talk about climate changes, and we talk about the fact that there's an initiative right now in Washington State that seeks to reverse one of the biggest climate commitment pieces of legislation in the United States that's going to completely reverse all our goals. I don't get into politics so much, but I say, if you really want to change this, this is, are you registered? Do you have a voice here? And so I back into the civic health as a way of people preserving their physical, emotional, and mental health. And anyway, I'll have to really think about the term because it's new to me and I really like it. But thank you for introducing me to it.
I love that, Anita. I feel like the way that I would answer that is that it's the concept that we teach about when we're talking to health systems about the connection between civic engagement and health. And exactly as I think Anita has modeled, it's not something that's like super intuitive and that people are thinking about. But it allows us to really lay the foundation of like the why are we talking about getting out the vote and other civic engagement activities, and really just like linking it to this concept of civic health. And so for us, it's more of like a teaching tool than something that we necessarily bring into that I necessarily bring into the clinical space. But I think it's incredibly important the way that Alia kind of laid it out, and the way that it allows us to enter into these discussions that are so important to connect your health outcomes to the political determinants of health, just, structural policy, structures and policies that have led to those health outcomes. And so I think the civic health kind of concept really gets at that in a nice, pithy manner.
Great. Question we have from our Q&A is, what is your approach to advocacy when you are still young in your career and not as knowledgeable as a senior person in your chosen topic?
I think that I'm happy to take this first. I think that this gets to what we were discussing earlier about some of the misinformation that we all have in our minds about advocacy, because it can feel like you should be, medicine is very hierarchical. Clinical medicine and other, forms of healthcare delivery can be very hierarchical. And so you're kind of told not to offer one's opinion or be active until you are expert, right? And the process of being expert takes many years and takes a while. And I think Anita was one who was saying, I'll show up to these conversations with elected officials with talking points, not because I'm an expert, but because, I've like prepared, right? And so for me, this question gets back to what we were discussing about what we wish we knew about advocacy, which is that there's expertise in having lived experience, and you should organize yourself from that reality, right? It doesn't take you many degrees to kind of understand that like nurses aren't safe walking through where they were walking and that advocacy is needed for that. And so I would just kind of disabuse ourselves of this idea that there's kind of future expertise that we need to get to be able to act and to do what we need to do. But I love this question from Jefferson, because I think that what it does is it makes us think a little bit purposefully about the coalitions that we build. So I think that if you have a focus area that you want to impact, it's important that you're thinking about who else is at the table or who's missing from this table, And so if you, as someone who's young in your career, want to move on a topic, let's say a topic that impacts a certain group, are members from that group co-designing these solutions with you? Similarly, are there experts who work on this topic who you could bring on to help you move this issue forward? So the framing isn't necessarily like someone with more knowledge and insight should be the one doing this. It's more like, let's build this coalition to have those with lived experience, me who's younger in my career, but also those who may be more seasoned researchers, etc., to all be a part of this to move in the way that we need to move. And I think, the kind of like organizational tactics there are so that you can use people's skills the way that you need to, right? And so that you're making sure that you're representing the issue as appropriately as possible. Especially since we often leave out of these solutions people who are most impacted. So I would just encourage you to kind of think of yourself as someone with a degree of expertise and feel confident to move, and also be mindful of who you're creating these solutions with and who's not at the table that probably should be at the table.
Yeah, love that. When Ellie Chapin and Mary invited me to speak, I said I have a tax to exert, which is that I have to market the VOTR phone banking that's coming up. So I'm going to use this as my opportunity to do that. We have reached 150,000 Americans this year already in terms of preparing them to vote. We have an ambitious goal of calling about 50,000 of those who are medium and low propensity voters and helping them make sure that they turn out by Election Day. In order to do that, we need you. So if you're looking for something to do right now, we have nonpartisan phone banking. We don't tell people who to vote for, but we help make sure that they know where to vote, when to vote, how to get to their polling location. We connect them to the free Lyft rides that have been set up to be able to get people to their polling place. So if you can spare us an hour and a half in the next, oh gosh, oh my goodness, in the next week, it's not like weeks, it's week. We would love to have you as we do this. There'll be some election day phone banking as well, if you can join us on election day, to make sure that people kind of have everything they need to get over that last file. So that's the first piece, is low lift way to get started, to practice and to bring the expertise you do have to the table. And we train you on how to do that. And then looking ahead, VODR offers a fellowship, which is not quite in the same terminology as like a medical fellowship, but it's like a kind of a 6-month course that meets 2 times a month, to teach you advocacy skills. And so it's led by some of the folks who helped overthrow Milosevic in Serbia. So they really know their stuff around how to build strong and effective movements, as well as led by medical staff from major hospitals around the country. And we really help people build campaigns that work within their health spaces and institutions. That will probably applications will open in March, and then probably the fellowship itself will start in April or May next year. So just dropped an early link about that in the chat. And if you just sign up for the VODR newsletter at the bottom of the page, you'll hear about it when it comes out. So those are my 2 early career answers to that question.
And I'll just throw in, since this is the time to pitch, that WPSR has training opportunities to learn how the legislature works. We also have training workshops on how to write letters to the editor. We have toolboxes with information. Whoops, looks like I froze there. Toolbox information that you're free to take and learn. So that's just one organization, maybe 2 organizations. Many organizations have opportunities for young people, early career people, to learn in small chunks and participate in small chunks.
Great. Another question we have from the chat is, what can you do to build coalitions and organizations if you lack funding, institutional support, and the resources to fairly compensate for the critical labor involved?
I'm happy to start this one. I'm gonna share something not about that I'm not necessarily bringing to the table, that I know our founder would share if he were here. So our founder is in many ways a social entrepreneur in a lot of ways, and has built a lot of like new initiatives and organizations. Some of you may have heard him speak at the Doctors for America conference earlier this year. I'm just going to tell you one story because I think it is powerful. In 2020, we were like, okay, we want to do this thing called Civic Health Month. It's a way that we can address COVID. Like, we can really shine a spotlight on this. So we're going to make August Civic Health Month. We needed to figure out how to get legitimacy for this thing. And we just this dinky little tiny organization with to the point in the chat, no resources. We finally got a yes from the American Academy of Pediatrics. We were like, yes, we've got a yes from the American Academy of Pediatrics. So what did we do? We then went to all the other major institutions and say, did you hear the American Academy of Pediatrics thinks that August is Civic Health Month? Do you want to join them? And that was how then the next tranche of 100, partners came on board, was that one big partner. So the thing I will say is, knock on a lot of doors. When you figure out your path into a particular door working, then really leverage that door to get you into more doors. But that is absolutely the story of how Civic Health Month went from being a thing on a piece of paper to being a thing in real life. Was we shopped it around, got one yes, and then we were like, all right, we're going for it. So yeah, I hope that is helpful. And I think that the reality of what's funny is the reality of that question is most of the biggest movements of our time and most of the things that have made the biggest impact, they started off lacking funding, lacking institutional support, and lacking the resources to fairly compensate for the critical labor involved. So the most powerful things that, for better or for worse, that we've done as a country and as a nation have often come from that location of being power down in society, but stretching in ways that help us build something that can move mountains together. So yeah.
And I'll just echo that. I think one thing I've learned is that coalitions of small organizations that are under-resourced and underpowered can build a really strong network. We saw that in our health inequities work with trying to get working family credit in our state, and many small, very small organizations, social justice organizations, and organizations interested in poverty and disenfranchised citizens got together and had a voice and got leverage. So partnerships, reaching out, it's possible.
It is, and I love both of those responses, and I think the idea of resourcing is important, especially if you're working with individuals from historically marginalized groups, to just value people's time and energy as best as you can. Many people in the healthcare field, I think, would be happy to give their time and give their energy to causes that are things that they really believe in. And so I think approaching this question from the perspective of, kind of like an equity issue of how do we make the small resources that we have go far? And so, the way that sometimes it happens when we're doing a panel is, maybe we'll like raise funds to be able to pay our student speakers on the panel, but we may not necessarily pay the attendings on the panel, for instance, right? Because we understand some of the inequities that are kind of in there. So I just think thinking and being mindful about how you make the small resources you have go far is another way to kind of imbue the movement with a sense of we value people in the ways that we can, and also we're small but mighty.
Great. Thank you all so much. We are going to close out in a few minutes here, but before we do that, if any of our panelists have like any last thoughts you want to share, things that you feel like we didn't ask any questions about, but you feel like you want to make sure gets said in this space or communicated to healthcare professionals in training.
I just
I would
love that you are all doing this for trainees and people who are starting off in their careers. I think this is such an important time. There is so much that we kind of forget from the idealized versions of ourselves from when we were younger as we move through our careers, and yet those versions are the change makers, right? And so just want to commend, DFA and you all for holding this event and for kind of asking these questions to really move ourselves forward as much as we can. And we have a week to go. So I think doing as much as we can to get out the vote and support our communities, our patients, our peers, our colleagues to vote and vote, and vote safely is something that I want to encourage all of us to think about doing.
And I just want to say, uh, I know as a medical student, I felt kind of small in this very hierarchical, at that time, pretty male dominated structure. But from the outside now, having medical students reach out and say, how can I help, is so exciting because we want so badly to get the next generation involved. So please reach out to me if you're at UW. If you have any interest in anything, don't feel afraid to reach out to attendings and people who are in positions of power in organizations where you might want to be helpful, because you will be very welcome.
My closing thought is about next Tuesday. In 2020, we had record turnout. Record turnout in 2020 was 2 in 3 eligible Americans voted, 1 in 3 didn't. I mentioned to you I'm a former school teacher. That's a failing grade in most schools. Sometimes it's a D in some schools. So our record turnout from 2020, which for the first time in 100 years we had that turnout, that means that was the highest turnout since the modern civil rights movement and kind of the enfranchisement of folks after Jim Crow, as well as after women secured the right to vote. We need to set some new records and make our record score not a D or an F, depending on which school that you're in, right? And if everybody on this call, there's 35 folks, I think, in our audience right now, if everybody on this call finds 3 people who they're like, gosh, I haven't talked to that person in a long time, but I just really want to make sure that they're voting this year. If we can all find 3 people, that would be 100 people. And I'm from Georgia, and I got to tell you, like, margins are tight where I'm from. So, just you have a ton of power in this next week to reach patients if you happen to have rotations or clinicals, to reach your classmates, to reach people from earlier in your life who you want to reconnect with. And, at VoteR, we don't tell people how to vote. We still have beautiful conversations about why people are so excited to have their voices heard as it relates to their health. So let's set a new record next week. And today is vote early day, so no better day to get started.
Great, thank you all so much. I'd like to close tonight's event by just thanking our speakers again for their thought-provoking comments and discussions, and we are just so grateful that you were able to join us. Before everybody leaves, we have a couple of quick announcements. This one is in the chat. Because voting is now considered a social determinant of health, please think about your voting plan for Election Day and that of your friends as colleagues. Call 3 people. A DFA member will put some, as I said, it's in the chat. Also, join us November 12th, which is just in a few weeks, also a Tuesday, for the next installment in the Med Student Advocacy series on how you can get engaged in federal advocacy. And there will be some registration details coming soon. Finally, thank you everybody for being here today, for all you do, and on behalf of patients, we hope that you will consider becoming a DFA member. And we also, as of all of our panelists have said, like, this is where change starts. It starts in showing up, thinking about what you can do, and starting from a place of passion and something that you feel you're good at. Nothing is too small. So thank you all for attending and have a great night.